Hey there. So could you please start by introducing yourself and telling us who you are, where you live, and where you work?
My name is Ajeng Larasati. I live in Jakarta, Indonesia. For the past 12 years, I work with a legal aid organization based in Jakarta, and it's called Lembaga Bantuan Hukum Masyarakat. In English, it is Community Legal Aid Institute. We provide free legal services for poor and marginalized groups. We also do some advocacy works, research, and community legal empowerment. We pioneered paralegals in the people living with HIV and key populations communities.
Thank you. Thank you. It's wonderful to see you again. I guess, we're all really addressing in our own communities and in our own countries the impacts of the COVID pandemic. For your work, and let's talk about it for LBHM really, like for the organization and particularly for the communities with which LBHM works, kind of how has COVID affected them as far as you know, and what does it mean in terms of the work of the organization?
LBHM work with marginalized communities. This includes people who use drugs, LGBT individuals, sex workers, and also people living with HIV and other urban poor communities. This COVID pandemic affects these communities differently. For example, our communities, the sex worker communities, they are badly affected, especially the transgender communities. They couldn't continue the work, but at the same time, they also couldn't access the government support for livelihood because many of them doesn't have identity card. What we try to do at LBHM, together with what we call Crisis Response Mechanism Coalition, we started fundraising for the transgender communities. And it was pretty much, to our surprise, it was pretty much welcomed by many people because people start giving us money to help the communities. Until now, the fundraising is still ongoing. For people who use drugs, apart from those who are out of work, another issue that they face is that access to treatment, especially those who are enrolled in methadone treatment. The government has a policy that take-home dose couldn't exceed 350 milligrams, if I'm not mistaken. For some people, it's a 2-day dose in total, and they couldn't take more than that back home. Some organizations, including us, are pushing the government to relax the policy a little bit and ensure them that these people will not abuse the methadone that they get from the clinic. For the urban poor communities, it is also difficult because the urban poor communities that we assisted is a city fisherman. So they are fishermen, but they live in the city. They still can go to the sea and catch some fish, but nobody come to the market where they sell their fish. They got home with still lots of fish because nobody buys them. Their wives, for example, they are out of job because many of their wives works as help people in the house cleaning services and things like that. They have to stop the work because their boss doesn't let them come to their houses anymore. It's fairly to say that it is badly affected the communities we are working with in different scales.
Can you think in terms of the populations you just talked about, do you think that there's a longer term impact with those going forward as well? Like how do you imagine as things, as restrictions get eased up a bit, like how that's going to affect these communities?
For the people who use drugs, for example, we certainly hope that the take-home policy will still be applied because at the moment, methadone clinics apply relaxation on their policy. Our communities can take a bit more than they usually be able to take home. We hope that these policies will continue. In my opinion, the sex workers communities, they couldn't go back to work as quick as the fishermen communities, for example. So they might still need support and assistance in terms of livelihood.
When you look at all the policies that are happening and that the government of Indonesia is putting into place because of COVID, are there any policies for you that are of concern? Or are you comfortable with what's happening?
since the beginning, the government started not so good. For the first case was found, the government saying things like, we are Indonesians, we are used to bad foods, and we pray a lot, so Corona couldn't come to us. The denial from the government since the beginning, it's kind of affected the way people think about Corona itself. Many people still don't think that the COVID is a serious thing, and they don't follow the government's regulations or the government policy to stay at home even though they can. And the government is not powerful enough, in my opinion, to enforce the policy of stay at home. There is an issue about information. The civil society feels like the government doesn't give the appropriate information to the society. They kept giving the wrong message. They kept saying that, look at our numbers, it's still a lot less than, for example, China. While the truth is, at the beginning, we don't even have the test kits to do tests. So, of course, the numbers is still low, but it doesn't mean that there is no COVID case. It's just that the government couldn't find it.
When you think about what's happened with COVID and the way the government has responded and the way the communities that you work with have responded, what do you think are some of the most important things that we as a society should take out of this experience? Are there any lessons? Are there things that we really should keep in mind going forward?
There are several policies that we've been trying so hard to advocate for, and the government just wouldn't listen. But with this COVID, they suddenly do that. I think at this stage, it is important for civil society, especially, to document what good policies that the government has and how it impacts the society, documenting the good sides, and showing that for the future we can still continue with this policy because it's actually a good thing, and you're worried that people will misuse it or do something bad with your policy or misuse your policy is not happening.
Thank you.
Thank you.
Take care.